I'm Dr. Barry Bittman. In this week's Practice Essentials, I'm going to present a few key insights for better caring for at-risk and principally Medi-Cal patients. Most doctors agree that there's far too little time to see patients with complex medical conditions. My first recommendation is intended for clinics with extenders, such as nurses, nurse practitioners, PAs, or social workers. This strategy is called empanelment, a patient-centered approach that matches each patient with a PCP and care team while taking both patient and family preferences into consideration. This team-based strategy is certain to improve both patient outcomes and satisfaction scores. My second recommendation I refer to as the Robin Hood effect, robbing from the rich to feed the poor. It actually has nothing to do with robbery. Instead, it's focused on spending the right amount of time with each patient, depending, of course, on their needs. All of us realize that a single fixed time slot schedule does not suffice to effectively care for patients who present with multiple diagnoses, comorbidities, complications, or social determinants of health. While it's obvious that some patients can be seen in 10 minutes or less, especially for routine med checks, others require far more time. I'm suggesting you consider abandoning fixed scheduling slots and instead utilize 3 distinct schedule durations, such as a half hour, 20 minutes, and 10 minutes. Patients in Category 3, at-risk individuals, are scheduled in the half-hour slots. Those who are for the most part stable or experiencing rising risk, Category 2 patients, are scheduled in the 20-minute slots. And basically, healthy patients with non-complex presentations, our Category 1 individuals, would receive 10-minute appointments. You're probably asking yourself who would assign your patients. The answer is simple. The provider or a designated care team member would place each patient in one of these 3 categories when scheduling the next appointment. The choice of time slots is of course subject to change whenever the need arises. The bottom line is simple: more time for sicker patients and less time for healthier ones. There are also a number of added bonuses. Imagine increasing RAF scores, improving cash flows through better quality outcomes, boosting patient satisfaction, and reducing provider burnout. For further information, please don't hesitate to contact Sandy Lozo, our practice support liaison. She is a phenomenal resource for your practice. In closing, let's work together to improve the healthcare of our communities. Thank you.